So the next thing we're going to do, this is called Gua Sha, which is Chinese for bringing out sand. And the reason why it's called that, we'll see in a minute, probably, is that it brings out little tiny red dots. It looks like a rash. It's not. It looks like it might be painful. It's not. But it really helps open up this whole muscle area, especially if they're like for whiplash or any kind of stiff neck and tight shoulders. It's really amazing. I call it my eraser because it just tends to erase all of that stiffness and tightness and pain. So first what we're going to do is put on a Chinese ointment. It smells really good. It's a sesame oil base with Chinese herbs in it that help relax the muscle and also protect the skin. So I'm going to put that over this whole area here. And I like to get the whole trapezius muscle as well as the rhomboids and all the other muscles involved up here. And even if we only have something going on one side, we do both sides. So everything's nice and balanced. All right, so that's the first step. Then the next step is we take a Chinese soup spoon and we start rubbing. So I'm going to start lower down here, and we're going to start to see this redness coming up on the skin. And it can be a little intense, so I like to give a little break, do a little massage in there too. And we're already starting to see a little bit of the red dots coming up here, which can also be diagnostic and tell us where there's stuckness going on. So right in here. So this redness is going to last a few days. At the most, it'll probably take a week to go away. But sometimes it clears within just a couple days. I'm using very firm pressure to get that muscle to relax and to pull out whatever needs to come out. Okay, so now I'm going to move up into this upper back area, and then we're going to get into the shoulder here. How are you doing?
Oh, it feels great.
Good. And lastly, we're going to go into the neck area here. This is also a great treatment for nausea up in this area, especially for women in the first trimester of pregnancy with morning sickness. This can work very well. Okay, that's great. Not too much stagnation going on because it's not too red, but mainly right in this area. So next time we'll do a little bit more work in this area to release it even more. All right, how does that feel right now?
Great, yeah, feels open.
Move your head around, see if there's any places that are still stuck.
Let's see. Like a little bit.
A little bit in here.
Yeah,
okay, so we'll just do a little bit more in here. Yep, that's the spot. I can see some of the little red dots coming up. Okay, that looks good. Excellent. All right.
Yeah, it feels more open now.
Good. All right.
Great, thank you.
You're welcome. So I'm just going to clean that off. And you are good to go.
Thank you.
You're welcome.